What is the best approach to fight ileitis? So far, ileitis has only been controlled with antibiotics or with an oral vaccine. This oral vaccine has mostly been used through drinking water. Individual intramuscular vaccination is a new and effective alternative. It guarantees in the most convenient way that each animal receives the required dose without altering their water drinking regime. Porcilis Lawsonia is the first injectable vaccine in Europe that controls Lawsonia intracellularis. These are Porcilis Lawsonia's characteristics. Intramuscular administration in a single step, one step and go. Porcilis Lawsonia is an inactivated vaccine with a maximum flexibility of use. It does not require the withdrawal of treatment, and it can even be administered mixed with Porcilis PCV Mayo, affording a triple protection with a single vaccination. The individual intramuscular vaccination allows for the administration of an exact dose to each animal, 2 milliliters. It provides 21 weeks of immunity after vaccination, protecting the pigs throughout the fattening stage. How can an injectable vaccine protect against a digestive infection? When the vaccine is administered by the intramuscular route, a molecular inflammatory process is developed due to the pro-inflammatory characteristics of the adjuvant. The released cytokines and chemokines change the tissue milieu and drive the chemoattraction of the leukocytes to the injection site. After that, dendritic cells start the phagocytosis and processing of the vaccine antigen, inactivated Lawsonia intracellularis. This process is pivotal to generate an acquired immune response, and it initially takes place at the vaccination site. Then, both dendritic cells loaded with the vaccine's derived antigens and intact Lawsonia intracellularis released from the vaccine migrate from the injection site to the regional draining lymph nodes through the afferent lymph vessels. At this site, the genesis of the acquired immune response will be developed. The soluble antigen, Lawsonia intracellularis, reaches the lymph node's primary follicles that are formed by billions of B cells. Each B cell is unique and capable of recognizing one kind of epitope. At random, B cells capable of recognizing epitopes on the surface of Lawsonia intracellularis through specific BCRs are selected and activated. In a parallel stage, specific T helper cells are produced in the paracortical region of the lymph node. There, dendritic cells with MHC2 loaded with Lawsonia intracellularis epitopes present antigens to the lymphocytes. Meanwhile, the activated B cells migrate from the primary follicle and undergo a second activation signal produced by T helper cells that have been activated at the paracortical region. After this second activation, the B cells begin to replicate. The result is the formation of a secondary follicle. In a few days, millions of selected B cells are produced, cloned, in the secondary follicle. To produce very specific antibodies, the B cells undergo an evolutionary process involving DNA mutation and selection. This process occurs in the germinal center of the secondary follicle. The hypermutated antibodies expressed by the B cells with a high affinity for the vaccine antigen displayed on the follicular dendritic cells are selected to proliferate after activation by Th follicular cells. This process is repeated several times to create high-affinity IgG secreting B cells. The low-affinity B cells that fail to recognize antigens undergo apoptosis. Only the B cells with the highest affinity remain from the variable population after the competitive selection. They will continue to mutate, somatic hypermutation, dividing themselves and testing their BCR's affinity until they differentiate into plasma cells that will produce massive amounts of high-affinity anti-Lawsonia intracellularis antibodies. A part of the high-affinity B cells will differentiate into memory cells. This whole process takes 14 to 21 days. Immunoglobulins, Igs, are translocated to the intestinal lumen through specialized receptors expressed on the enterocyte membrane. The Igs will become trapped on the mucosal surface by the mucin, and then they will carry out their task, i.e. neutralize the infection process caused by Lawsonia intracellularis. The presence of high-affinity Igs on the ileum's mucosa blocks the ability of Lawsonia intracellularis to infect the intestinal crypts. This is the protective mechanism induced by the vaccination that prevents clinical and subclinical ileitis in piglets. Now that you know how it works, discover its benefits. Lawsonia-related mortality drops in the vaccinated animals. It reduces diarrheas and intestinal lesions. Based on field trials, we've seen that vaccination improves productivity, average daily gains increase, and feed conversion rates decrease. It reduces the fecal excretion of Lawsonia intracellularis. It provides 21 weeks of immunity after vaccination, protecting the pigs throughout the fattening stage. It ensures that every single pig receives an exact vaccine dose. It can help to reduce the use of antibiotics used to treat Lawsonia intracellularis infections. It does not interfere with feed, antibiotics, water chlorination and/or poor water quality. It can be reconstituted with Porcilis PCV mayo in combined use. According to the field trials, the result is a better performance. Porcilis Lawsonia allows you to fight an invisible enemy with precision.